This is an important day for the people of British Columbia. I firmly believe that no worker should have to choose to go to work sick or stay home and lose wages. But about half of BC workforce does not have paid sick leave. The workers without coverage, usually the most vulnerable workers in our society, those in low-paying jobs, often women and racialized people. These are the very people who can least afford to stay home and lose wages when sick. Together, we have learned many difficult lessons during this pandemic. One being how important it is for workers to stay home when they are sick and not lose wages. That's why last May, our government introduced 3 days of paid sick leave. This particular leave was directly related to COVID-19 pandemic. This has made a big difference to workers who can stay home and get healthy with peace of mind, to employers who are ensuring that the customers and their employees are safe, and to our community by reducing the spread of COVID-19. Now we must look to the future. Everyone values safe workplaces. Employers do not want their employees to come to work sick. They have made this point loud and clear. Paid sick leave is the best way to achieve this. So for the first time ever, we are creating permanent province-wide paid sick leave starting January 1st, 2022. After an extensive consultation and with input from many voices, we have made a decision. All workers covered by Employment Standard Act will be entitled to a minimum of 5 days of employer-paid sick leave each year. Now, everyone gets sick from time to time. And now we are the first province to implement a minimum standards of 5 days of paid sick leave each year. Workers, employers, community members, and activists have all shown us this issue is important to them. Over 60,000 workers and employers responded to our public consultation survey to have their say on a paid sick leave program in BC. We promised to listen to everyone's perspective and develop a fair and balanced regulation. And this has been done. Not surprisingly, some have called for 3 days or less, while others have asked for 10 days or more. 5 days is a sustainable solution given the challenges faced by many sectors. As our province recovers, I encourage businesses to recognize the economic and social benefits of providing paid sick leave. The experience in other jurisdictions has shown many positive economic and social benefits of paid sick leave, such as increased productivity, higher retention, and increased labor force participation, especially for women. Having paid sick leave is good for businesses, good for workers, and good for our communities. This announcement means BC will lead all other provinces. It is a step that will help our economy recover faster and help businesses retain more workers in a labor shortage environment. And I commit to you today, we will continue our effort to make life better for all British Columbians, to build safer and more inclusive workplaces, to protect and support the most vulnerable workers in our society, and to remove barriers to success that many workers face every day. It is the right thing to do. And now I would like to ask Dr. Henry, our provincial health officer, to say a few words.
Thank you very much. It's my pleasure to be here today to support and give my thoughts on this government's decision. There have been many, many lessons that we have learned from the COVID-19 pandemic. And one important lesson is that, as I've said many times, we are all in the same storm, but we are not all in the same boat. And we have seen that the pandemic has exposed and amplified inequities, and experiences have been quite different for different groups of people. For example, we know that women, marginalized populations, lower income people, and racialized people have carried a much heavier burden during this pandemic. And we know that economic policies have health impacts. We have seen that. And we have seen that health of workers impacts our economy. We also know that for some people, job security is tenuous. And this has increased during the pandemic. And we've seen that in many parts of our, many sectors, including in healthcare, including in food production, and many others. This means that even though individuals may know the public health advice, what we are asking them to do during this time of the pandemic, following that advice and staying home from work and away from others when they are ill is very, very challenging. For some, staying home means potentially losing their job or stable housing or not being able to provide food for their families. These are choices that nobody should have to make. And we know when someone is forced to go to work when they are ill, the workplace is at risk, and we have seen that too, where whole workplaces need to be shut down. Colleagues are at risk, and colleagues have a much greater likelihood of bringing the virus home to their families and it spreading in our community. And we have seen this far too many times. I have been an advocate, and as my public health colleagues have, for this as a way to give people the means to follow our advice for a long time, even before this pandemic. But it has become starkly apparent how important it is in the last year and a half. With today's announcement, workers now have an important tool to take care of themselves and those around them. The ability to stay home and not lose your job or a day's wages is really important. This new approach will protect workers everywhere and also protects all of us because it's helping break those chains of transmission that we know can happen when people are closely together. And ultimately, it's one of the steps that we need to help put this pandemic behind us. As the provincial health officer, this is welcome news, and I'm pleased the government has made this decision. And I'm confident that my public health colleagues and healthcare workers everywhere who are treating those who become ill welcome this news as well. Thank you very much.
Our next speaker will be Anita Huberman, the President and CEO of the Surrey Board of Trade.
Good afternoon. We acknowledge that the land on which we gather is the traditional and ceded territory of the Tsawwassen First Nations and the unceded territory of our Coast Salish peoples, specifically the Katzie, Kwantlen, Coquitlam, Kaikut, and Semiahmoo First Nations. And I'd also like to acknowledge the Inuit and Métis peoples from Surrey, British Columbia. The Surrey Board of Trade, in what will be BC's largest city soon, is one of the top 10 largest chambers of commerce boards of trades in Canada. There's 450 of us, and we support an increase to 5 paid sick days because too many Canadians are going to work sick. Why? Because they have no other choice. Many Surrey residents work in warehouses, manufacturing facilities, retail, construction that form the region's economic backbone. These workplaces can become sites for the mass spread of viruses unless all the right precautions are taken. The most important precaution: infected people don't come to work. But many employees don't have access to paid sick leave. If they take a couple of days off to get a test and isolate while awaiting the result, they could be docked a couple of days' pay or worse. Their choice is stark: go to work while sick to collect a vital paycheck or stay home and receive no money. That's why many people in Surrey, and no doubt across Canada, are going to work when they're sick. Increasing paid sick leave to 5 days is an economic imperative. Your workforce is your most important asset. That's what the Surrey Board of Trade believes. Let's take care of them so that we can focus together on increasing the bottom line for businesses. It's true that responsible firms already pay sick leave, but others are not able to or simply won't. Giving sick leave prevents virus spread within a company and shows goodwill to employees. 3 days is probably too few, and 10 is probably too many if the employer only pays. That's why the Surrey Board of Trade supports 5 days of paid sick leave as mandated by the BC government as announced today. Providing sick days increases productivity as well as morale. It's a win-win for workers and for employers. Thank you for listening.
Thank you, Anita. I really appreciate you coming along with us. Next, I would invite Sheila Lewis of the Métis Nation, British Columbia, to say a few words.
Sheila, please.
Hello. Thank you for the honor and privilege to join you from the traditional, ancestral, and unceded Syilx territory, also the chosen home of the Kelowna Métis Charter community. It's with hands up to you, Minister Bains, and your team in the Ministry of Labour for this important announcement regarding paid sick leave. This will have a meaningful impact for our Indigenous women seeking to enter or even re-enter the labour market, especially after the devastating impact of COVID-19 on the labour force that gave rise to terms like she-cession and shadow pandemic. Indigenous women pre-pandemic already faced several systemic barriers in attaining and retaining meaningful employment. With this announcement about paid sick leave, Indigenous women will materially experience improvements in their career journey. Women are broadly at the heart of multiple responsibilities in our communities that include child rearing, caring for aging parents, maintaining homes, and stable employment. To have access to 5 paid sick days will alleviate concerns about how to manage competing priorities and provide Indigenous women more ability to engage in BC's labour force. Again, hands up to you, Minister Bains and the Ministry of Labour for helping BC lead the way in a recovery that is feminist-led. Thank you.
Thank you, Sheila. Appreciate you joining us. And now we are ready to answer any questions.
Thank you very much. A reminder to media on the line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up. Our first question today goes to Binder Sajan, CTV.
Hi there. I'm just wondering about the COVID, the temporary sick day program. We know from some reports from the seniors advocate that sometimes staff are going to work sick because of staffing levels. So do we have an idea of sort of how well the 3 days worked? And Minister, you said it's a minimum of 5 days. Can you explain what you mean by that?
Thank you for the question. Yes, I think when we passed the legislation in May to have to deal with the immediate issue that we were facing, where workers were forced to make a decision to go to work sick or stay home and lose pay, which many of them could not afford to stay home and lose pay. So we brought in 3 days, employer paid, and also to be reimbursed by the government up to $200 per day. So this was to allow workers to so that they could stay home and without a fear of losing pay. So I think it has worked. I think again it shows people take time off when they need to, when they're sick. And during the consultation, we found out that 98% of employers also show that there is no abuse. So I think it is a win-win situation for all.
Binder, do you have a follow-up?
Yes. Just wondering what happens for those who are not covered by employment standards, like those who are self-employed or those in the gig economy. Is there some sort of plan for how they may qualify at some point for sick pay?
Yeah, so going forward, this would cover all employees who are covered under the Employment Standard Act. And yes, there are self-employed and there are people who are excluded from the Employment Standard Act. And Parliamentary Secretary Adam Walker is working to take on that issue. So going forward, you'll hear more from us. How do we deal with those workers who are employed in that industry, in that sector, what coverage they have now, and how do we provide coverage so that all workers in British Columbia have a minimum protection, especially during the time when there is a flu season or when there's a pandemic, that the people aren't forced to go to work when they're sick, that they can afford to stay home.
Next question, Patrick Berthour, Globe and Mail.
Hi, this would be for Dr. Henry in the first instance, although interested in what anyone has to say. So the province cut the budget for the 3-day program by 95% in the last fiscal update, and economists have said that BC's program and other provincial programs were very lightly used. I'm wondering why you think that is and what could be done to remedy that.
Actually, I could touch on this. When we put together a 3 days paid with the reimbursement provisions in May, we estimated there are about 1 million workers who do not enjoy any paid sick leave in British Columbia. And that the estimate was, because we were still going through a pandemic and case numbers were high at that time, that maybe perhaps 60% of the workforce may utilize this. So based on that, we set aside enough money so that in the event that all 60% utilize all 3 days, then there will be a sufficient money and resources available to them. But our experience shows that far fewer workers actually utilized that benefit, and that's why I think the budget adjustment is there.
I can't talk to the budget issues, but I will say that when we look at the impact that outbreaks have had in workplaces, and our colleagues from the Surrey Board of Trade know this well, we had a lot of transmission in workplaces in the second and third waves of the pandemic, and it was a very challenging time, and that was when we put in other provisions to support workers to be able to, and many businesses had to shut down for periods of time. What we have seen as we have increased immunization rates, that has fallen off. So we've not had the same impact on workplaces, thankfully, in this last fourth wave that we saw earlier on, and that really is because of the high rates of immunization, particularly in many workplaces where it's been required. And I look at healthcare, for example, where we've taken a number of measures, but one of them is to make sure that everybody's vaccinated to help prevent those outbreaks that were shutting businesses and workplaces down, and transmission between workers in workplaces.
Patrick, do you have a follow-up?
For the minister, economists have talked about how some workers, particularly, as you noted, some vulnerable workers might have not had access to these days before, might not feel as comfortable using them, might feel that they would be penalized in some way. What enforcement or other mechanism would you have to make sure that workers feel able to take full advantage of these sick days should they need them?
Yeah, I want to make it clear that this is not optional. This is the law starting January 1st, 2022. Just like other minimum standards that we have established in the Employment Standard Act, like a minimum wage, like overtime provisions, or the vacations, that now the worker will be enjoying 5 employer-paid sick days if they are too sick to go to work and then take a time off. And if employer refused to pay, just like other wages, they have avenue available to them through Employment Standard Branch, and that's how they could collect the money. But I expect most employer already have paid sick leave provisions in their work. Actually more than half of the employer, but it is the other half that we are talking about, and it's just like paying wages, and it will be enforced through Employment Standard Branch.
Next question, Richard Zussman, Global News.
As you know, Minister, the federal government is promising to bring in 10 paid sick days by the end of this year. Why has Ottawa been able to put in 10 days and British Columbia opted for half that?
We're talking about 2 different workforces. What Ottawa will do, if they do, they will cover workers that are covered by the federal jurisdiction. And by and large, they're all large employers. You're talking about airlines, banks, and the shipping industry, and other interprovincial transportation communications. And what we're talking about in British Columbia is a very different dynamic of businesses. 98% of businesses in British Columbia employ 50 or fewer employees. And also through our consultation, regardless how many days employees were entitled to, those who enjoy paid sick leave provisions at their workplaces, or for the matter of a larger workforce, 87% of the workers advised us that when they felt too sick to go to work, they utilize 5 days or less. So we believe that the 5 days is the right balanced approach to take, and also considering that the businesses are still hurting, and using the research and data available to us, we believe 5 days is the right approach in British Columbia. And again, the BC will be leading other provinces, and it is the right thing to do.
Richard, do you have a follow-up?
Are you saying just because someone may work for a larger employer, they should be entitled to more days? Like that, I don't fully get that. You mentioned the larger industries and somehow they can provide 10 days. Could the province not have, to support those small businesses, supplemented additional days so that not the full burden was not carried by these small businesses?
What I'm saying is that our data through our consultation process advised us that people who felt too sick to go to work, they utilize on average less than 5 days. And other jurisdictions, when we looked around on other North American jurisdictions in Europe, they support that research as well, that 4.8 was the average in those places where they have sick days available to them. That's how many days they were utilized.
For the next question, we come to the room. We'll go to Shannon Waters, BC Today. Shannon, please go ahead.
Hi, Minister. Again, I want to ask about how you settled on 5 days. Looking at the results from the consultation, it looks like most workers say they need 10. And I'll just note that when your government introduced a temporary 3-day program, the Premier said that 3 days were enough time to feel sick from COVID, get tested for COVID, get the results, and then access federal benefits and supports. So I'm wondering how your government has now decided that 5 days is enough for workers over the course of a full year to keep them from going to work when they're sick.
Thank you. When we came at that time the temporary 3 days paid sick leave in May, it was to fill the gap that was left by the federal program. Federal program requires that you must lose 50% plus in a week in order to qualify for the federal program. So 3 days will get us over that. And otherwise, if you lose 2 days, they were not entitled to any sick benefit from the federal program. So that went a long ways in addressing that issue. But we also said at that time that we will come up with, the legislation was clear, that there will be a permanent sick days available to all British Columbians covered by the employment standard starting January 1st, 2022, and that we will consult with the businesses, with the workers, and other advocates who would be impacted by that decision. So we had 60,000 the survey return giving us their opinion. They were wide-ranging. There were some who were saying 10 days plus there should be the minimum, and then there were others who were saying don't do anything. So when we looked at how many actual days workers are utilizing when they are too sick to go to work, 87% of them reported that they utilize 5 days or less. So that's how we arrived at that based on the data and that research.
Shannon, do you have a follow-up?
Yeah, I mean, I guess I'm still curious. People only use what they need, but at the same time right now, a lot of people don't have any sick days that they are able to use. So asking people how many they use doesn't seem like a great metric when their option may be facing, a reduced paycheck versus going to work sick. So we've seen a lot of advocacy and a lot of research being put forward on this issue over the past few months. The BC Federation of Labor has been pushing for 10 days, comparing BC to other jurisdictions around the world that offer, 10 days or more. And provide, workers with a lot more options when it comes to, paid sick leave. A nasty flu can knock you out for 2 weeks. COVID can last a lot longer than that. So I guess what would you say to workers who were hoping for more from your government?
Yeah, I think it's all about balance and listening to people and being sensitive to what we are told. And we said that we will listen and we will consult, and we did. And the data that informed us how to move forward, by way of how many days, is based on what we heard from the workers, from many employers, and what the utilization rate is. In addition to that, we did look at other jurisdictions in North America. And there are a number of days available in different jurisdictions. But again, the data came back that 4.8 were the average where most people utilized. Now, again, you could be sick one day on Friday, and then you have weekend to recover, and you go back to work Monday. And then you need another day somewhere else when you become sick for a couple of days. So I think it is a right balance. It is the right way to do, and I think it is the right thing to do at this particular time.
We have time for one more question. We'll go back to the phones and hear from Lisa Yusta, City News.
Hi there, Minister and Dr. Henry. Wondering what happens if there's another surge in cases, like the same kind of thing that we saw that instituted the first, the 3 days that you did last year. Will this increase? Will there be a temporary program, anything of that sort?
Well, I think, we will look at and respond to a need at that particular time, as we have done in the past. Like, we have taken a number of measures. First thing we did was, beginning of last year, was to give a job protected leave to all workers who become sick because of COVID. And then we came we made changes that there would be 3 unpaid days. Then we added paid time off to go get vaccinated. And all of those programs have been very, very successful. And Dr. Henry said that the high immunization rate in British Columbia is the result of a number of steps that have been taken by a number of different ministries. And if the time comes for us to consider at that particular time, with the advice from our health officers, and we would adjust to our needs at that particular time, because at the end of the day, it is the health and safety of our British Columbians, and that's what our focus has been in the last 18 months.
Lisa, do you have a follow-up?
Yes. Will there be any sort of assistance for these smaller companies who might have a very hard time, going through a hard time already, and then fitting this into their budget?
Well, I think one of the things that we learned through consultation and our research from other jurisdictions where paid sick leave provisions do exist, we learned that the benefit of paid sick leave far exceed than the cost or the modest cost that comes with paid sick leave. For example, the business who have paid sick leave provisions, they have a healthier and more productive workers. They have increased retention and reduced training cost, in reduced risk of injury and spread of viruses in workplaces. And I might add, not having paid sick leave provisions in British Columbia in April and May, in Fraser Health Authority alone, there were over 180 businesses that had to be shut down. That is a very, very costly a situation for the employers to be in. So I think it's a win for the employer, it's a win for the workers, a win for our society, and I think certainly for our healthcare system.